A deadly disease is rampant across the metro area, and scientists are calling it an epidemic. Channel 2's Dave Huddleston met with doctors who are now comparing parts of the metro area to third world countries.
That's exactly right. The Centers for Disease Control and Prevention statistics suggest 1 in 51 Georgians will be diagnosed with HIV in their lifetime. And Atlanta is the epicenter of the Southern epidemic.
Come on.
J.R. Watson has AIDS. He says he contracted it from a woman he was dating.
Sat there and I literally cried like a baby for 30, 45 minutes. And all it took was that one time with that wrong person to change your life forever.
A life that requires dozens of pills daily, so many he uses a tackle box to store them. He shares his story so everyone understands AIDS can hit anyone.
It doesn't matter who you are. Just because you live in a nice neighborhood, you live outside of Atlanta.
But if you live in the capital city, AIDS research officials say the number of people affected is staggering.
Downtown Atlanta is as bad as Zimbabwe or Harare or Durban.
Emory's Dr. Carlos Del Rio compares Atlanta's AIDS problem to third world countries. How did it get this bad? He says the disease now affects just about every population, but in particular African Americans with limited access to health care.
Don't have food on your table, have kids to take care of, and somebody says you have HIV, that's just another problem that you have.
Another problem? A lack of leadership and mismanagement. In this audit of Fulton County's HIV prevention program, it cites poor management and the staff's inability to use millions of free dollars given to them by the CDC to educate and serve high-risk HIV communities.
Well, it certainly was a bruised eye.
After learning of the problems, Fulton County Chairman John Eves demanded new leadership.
I did meet with city officials directly and assured them that processes were in place to make sure going forward monies would be better accounted for.
Here's why that's critical. The Centers for Disease Control and Prevention says if you live in the Southeast, you're more likely to be diagnosed with HIV than any other part of the country. In Georgia, the risk of diagnosis leaps to 1 in 51.
We should not be having an epidemic of that proportion in a country like ours.
But we are. Fulton County now has a new public health director, and
Part with the fingerprint comes in, okay?
It's now steering its mobile HIV testing unit into hot zones, zip codes with the highest number of HIV cases. The day we were with them downtown near Grady Hospital, they tested more than 30 people. 2 came back HIV positive.
HIV has not abated. It has not gone anywhere.
That's it.
But fortunately for Watson and others with AIDS, it is no longer an automatic death sentence if you receive treatment. Watson also found love and is now married.
I fall in love with her more every day, and that's no lie, that's no exaggeration.
Fulton County officials told me they now have a new health department director, and they also said they are working with an HIV task force on new programs to educate Georgians, get folks in low-income communities tested, and more importantly, keep those who test positive in treatment.